Hi there, it's Tim Jen. So today we're going to talk about the brachial plexus as well as the interscaling block. So usually I asked residents who come in to draw me a picture of the brachial plexus, and I challenge you to do so right now to really get a firm understanding of what the brachial plexus entails. So first of all, you start off with the roots, okay? So there you go. If you want to label them, C5, C6, C7, C8, and T1, okay? So these are the roots of the brachial plexus. They then join to form the three trunks that are there. So trunks, and these would be the superior trunk, the middle trunk, and the inferior trunk. These then form divisions, so they look like this. Each have an anterior and posterior division, each trunk. So the three posterior divisions would join to form the posterior cord. And the anterior divisions will also form their own cord. The specifically the superior trunk and the middle trunk, their anterior divisions will form the lateral cord, and the inferior trunk will form the medial cord. And after the cord, then it usually forms the branches. So there's an M shape as such. And the posterior cord also continues on as such. So from the lateral cord, you'll get the musculocutaneous nerve. And from the joining of the lateral and medial cord, you'll get the median nerve. From the medial cord, you get the ulnar nerve. And from the posterior cord, as an extension of it, you get the radial nerve. So that's the basis of it. But now we must supplement it to kind of get a full understanding, full picture of what's happening. So first of all, C5, there's a branch that goes out to your phrenic nerve. Okay. And from C5, you also get the dorsal scapular nerve. Okay, and dorsal scapular nerve goes to the rhomboid muscle as well as the levator scapulae. The C5, 6, 7, they also join together. Excuse me. C5, 6, 7 join together, and they form the long thoracic nerve, which goes to your serratus anterior, okay, which prevents the wing of the scapula. It pulls your scapula forward. And from the superior trunk, you'll get a branch out, which is the suprascapular nerve, which is classically the nerve that supplies the majority of your glenohumeral joint for shoulder surgeries. Now for the lateral cord, you'll get the lateral pectoral nerve, And the medial cord, you'll get the medial pectoral nerve, you get the medial cutaneous nerve of the arm, as well as the medial cutaneous nerve of the forearm, okay, which supply the medial side of your forearm as well as the medial side of the arm, okay. And the lateral and medial pectoral nerves obviously go towards your pectoral muscles. Your posterior cord, it gives off a few branches in addition to the radial nerve. It gives off, importantly, the axillary nerve, which supplies the deltoid muscle as well as skin above the deltoid. You also have the thoracodorsal nerve, which goes to your latissimus dorsi, and you also have the upper and lower subscapular nerves, okay. So this basically is the the framework you are working with when you think about your brachial plexus blocks.